The Philippines has been polio-free since 2000, but then there was an outbreak that resurfaced in 2019. Although the country's health department declared the end of the outbreak in 2021, preventive measures to boost the country's efforts against polio continue. And as the world commemorates the Polio Day today, we speak to UNICEF Philippines Immunization Specialist, Dr. Carla Ante-Orozco. Good morning, Dr. Orozco. It's nice to have you.
Good morning, Priya, and thank you for having me.
Doctor, first, could you give us a picture of the polio status, not just here in the Philippines, but around the world? How is the world dealing with this life-threatening disease?
Yeah, thank you, Ria, for the question. So just to say that today we are commemorating the World Polio Day, and we want to emphasize the importance of the polio vaccines in preventing lifelong diseases and paralysis from polio. So worldwide, this is also being celebrated, and we bring importance on this important vaccine in preventing paralysis and deaths of children. And even in the Philippines, we are continuing our support to the government in continuing its efforts as well, especially vaccination in preventing polio diseases and possible deaths as well.
Now, the Philippines was declared polio-free way back in the year 2000, and then there was that outbreak in 2019. How did we come to, basically eradicating the disease in 2000, and what caused that outbreak a few years ago?
Okay, so the Philippines has been declared, as you mentioned, polio-free. We actually haven't eradicated polio yet, even globally. Primarily, what we were declared polio-free because of our vaccination efforts. It's only really vaccines that can prevent the occurrence of polio diseases and deaths. But through the years, we've seen the decrease or the decrease in the coverage of polio vaccinations in the Philippines. So in 2019, that was the time when really we've seen a large number of susceptible children for polio as well as for other diseases. And that's why we had a polio outbreak in 2019. And I think our efforts as well in 2019, 2020, and even 2021 through the supplemental immunization activities, vaccination campaigns as well, also helped in declaring the country as polio-free again in 2021. But of course, the country is again at risk for possible occurrence of polio as well as measles, which are highly infectious diseases, if we don't improve our vaccination coverage today and in the coming months and in the coming years.
Absolutely. And of course, as you mentioned, their children are at high risk of contracting the disease. What exactly is UNICEF doing to intensify your immunization campaign against polio?
Okay, so primarily we are supporting the government in its efforts in the campaign against polio and other vaccine preventable diseases. We do this in many ways. First, we provide as well as we support supplies for vaccinations, and that would include vaccines as well as cold chain equipment where these vaccines are. We also support improving information dissemination. So this is demand generation activities. We provide also support in capacity building of health workers in the field and even at the national level as well. And we also provide support at the field level through monitoring and evaluation activities so that the vaccination program would improve. So that's how UNICEF is supporting.
Right. It seems you have all grounds covered there. Now, accessibility is always a fundamental concern, especially for Filipinos. How can Filipinos get vaccinated? Could they get their shots in a local health center for free, for example?
Yeah, the good news is polio vaccines as well as other childhood vaccines are provided for free by the government, and these vaccines are available at government health centers nationwide. So wherever you are, you might be in the city, might also be in a geographically isolated, disadvantaged areas. For as long as there are health facilities, there are health centers, it's available. So I would really encourage mothers, caregivers, even those titas and titos to bring their children, nephews, and nieces to the nearest government health centers to have their children vaccinated. It's free, it's available, it's effective.
All right, Doctor, thank you so much. Thank you for speaking with us this morning. That was UNICEF Philippines Immunization Specialist, Dr. Carla Ante-Orozco. Thank you for your time.